good. My name is Jess Kimball. I am a birth and postpartum doula, so I'm going to be talking about what doula support looks like. And then I'm also currently completing my lactation clinicals here to sit for the IBCLC board. But I'm a lactation counselor at the moment, so I'll talk a little bit about lactation support as well. I wanted to ask, does anyone here know what a doula is? Have you worked with doulas? Okay. Are there anyone want to share kind of what their understanding is of what a doula does?
My understanding, for at least in the labor and delivery room, is that it's another person who's like supposed to be more knowledgeable, so that like you have and they're there for mom more than like, husband can just be like his thing, like helping mom and baby too, but they're like, I don't know, like it helps support the
They advocate and support the mom throughout the entire pregnancy and afterwards. That's my understanding.
Okay, you all know more than the average people I run into out in Boone. Most people are like, oh, are you a midwife? Do you do some kind of like medical support? And I think that's the biggest myth of like misconception about doulas is we're not medical providers. I don't do anything that's clinical. Even as a lactation counselor, since I haven't taken my boards and become a lactation consultant, nothing I do is considered medical support. It's all informational, emotional, a little bit of physical support. And yeah, really my role is being there for the mom. But sometimes that can look like if there's someone who's in labor and their partner wants to support them, but they just don't know how. Like maybe they don't really know the counter pressure techniques that I know, or they don't really understand what's happening because it can be really chaotic in a birthing room. I'm able to step in and kind of explain to the partner how to do something to support the birthing parent. So I'm not replacing anybody in the room. I'm just an additional support that can kind of better the situation. I think that doulas are great and that they are there to kind of add to the whole team. We do advocate for clients. I think that it's really important that doctors know that my job is not to speak for my client. If they're like having a contraction and it's really intense and they're just kind of like in the zone doing their thing, and say there was a shift change and a new nurse comes in and is like introducing themselves, I might be like, hey, like my client really wants to keep the lights low. We want to keep it as quiet as possible. Like here are some things that are important to my client, but I'm not stepping in and saying like, we have to do these things, or like undermining a doctor or medical provider. My role is not to say like, no, here's the birth plan we came up with. We're going to follow this exactly. It's to, if something comes up and an intervention is needed and all of the medical providers are kind of like rushing to get that intervention set up because there's some urgency, I'm able to like squat down where my client is and make eye contact and explain what's going on and be a comforting support. And I think that there are a lot of providers, in my experience, every hospital is different, but there are some providers who are nervous about having a doula because that term like advocate brings up some fear around like, is this person going to get in the way of something that's medically necessary? And my role is not to do that. It's to provide information for my client when things are going on in the room where nobody else has that time to stop and do that. There's a lot of research that shows continuous support throughout labor leads to better birth outcomes, less C-sections, less interventions needed. I've worked with families who deliver at home. I've worked with families who deliver in birth centers. I've worked in several different states. I've worked in different countries. I've attended births where we know it's going to be a C-section. It's scheduled. I've attended births where someone gives birth at home and that was not the plan and we didn't make it to the hospital in time. Growing up, my brother was born in the car on the way to the hospital. So these were just like things that I heard. And my goal isn't to push one kind of type of birth. It's really to meet the family where they're at and talk about their goals and see if we can reach those goals. If they're really, really wanting no medication at all, seeing what we can do to get them to that point. Maybe they're okay with the epidural, but they really, really, really want to avoid a C-section or any kind of forceps, episiotomy, stuff like that. Recommending different laboring positions and different pain management techniques, like getting up and moving around, being on the birthing ball, things like that to kind of ease the labor. I think that doulas are becoming more common, but we're hearing more about birth doulas, and there are different types of doulas. My specialty is actually the postpartum period. Birth doulas, we hear about birth and postpartum doulas, I think, more, but there are doulas who support the family during fertility, like if they're going through fertility treatment and they want that emotional support, someone coming along to appointments to kind of explain things, because I think that everyone knows that appointments just aren't as long as some families need them to be, and doctors don't always have the time, midwives don't always have the time to answer every single question. And sometimes a pregnant person will go to an appointment and they get home and realize, like, oh, I didn't even ask all the questions that I have. So instead of them going down the Google, mom forum rabbit hole that kind of leads to more anxiety, I see so many families, they'll post in like a Facebook group and ask a question and there's 200 comments and nobody knows what they're talking about. It's just different moms kind of saying, here's what happened when I was pregnant. Here's what my doctor recommended. Here's what my midwife recommended. This was 10 years ago when I had my kids, or 20 years ago, but here's what my doctor recommended. And it just kind of feeds that anxiety, which we know that perinatal mood and anxiety disorders are on the rise in the U.S., especially in more rural areas. Especially post-pandemic. And then, we just had the hurricane, so we're seeing cases of PMADs increase. So having a doula where they can reach out and ask a question and know that they're getting evidence-based information, I think can be really beneficial to families. So the support that I offer extends from pregnancy through the birth, through postpartum, but there are specialized doulas who focus like just on fertility or just on postpartum, or even death doulas who are focused on like pregnancy and infant loss, or end of life doulas where they're kind of working with hospice, like someone who had cancer and knows that they're going to pass soon, working with that person to kind of help with that transition. So my focus, I really love the postpartum period. There are a lot of like different terms that get thrown around for what I do. Like some people will call a postpartum doula a night nanny or a night nurse, but again, not a nurse. There's no medical support being offered. My focus is really, the big thing I do is overnight care. So I'm with the family throughout the night. I take care of the baby when the mom's asleep, but when she's up, I'm helping with lactation support. I'm cleaning pump and bottle parts. I'm having those late night conversations with the mom about anxiety and like whatever thoughts are coming up. So much of what doulas do, I think, can improve the physical health of the mother, but I really connect it all back to mental health. The second leading cause of maternal mortality in the U.S. is behavioral health concerns like substance misuse and suicide. And with perinatal mood and anxiety disorders being on the rise so much, I think that doulas offer a type of support that can really help kind of lower the risk of that by helping the mom get more sleep. We know that sleep is a huge concern postpartum, and if someone's getting good sleep, they're less likely to have postpartum depression. Obviously, we're still seeing like baby blues, but those bigger concerns of like postpartum psychosis, postpartum OCD, anxiety, depression are lower if they're getting good sleep. And then I also, like, I think the postpartum period is really important because 80% of maternal mortality deaths are happening in the community after someone gives birth. So in the news, we hear a lot about maternal mortality. I'm sure you all talk about it a lot. But I think people hear that and they think like someone's dying while they're giving birth. But really what's happening is there's complications postpartum, like postpartum hemorrhage. I've seen lots of cases of retained placenta where they get home and something just seems wrong and they push off going to the ER because they have a toddler to take care of and a newborn, or their partner's at work and they don't have anyone to drive them. And having a doula there that can kind of watch for some of the warning signs and say like, okay, I'm noticing these signs, we need to call your doctor, or we need to get you to the ER, and be there to offer that support, I think can be really, really beneficial. Some of the issues with doulas, though, are insurance doesn't cover doula care. We are seeing a little bit of that changing with Medicaid coverage. United Healthcare will cover doulas through their Medicaid, and Healthy Blue covers doulas. But a lot of families don't know about that. So I think providers kind of being aware of what coverage there is, and any other local resources, like some doulas may offer a sliding scale. There might be a nonprofit that covers doula services. But if you're aware of those things and kind of you notice a family that might need a little extra support, kind of mentioning doulas to them, because I think I was in Vermont the past few years, and up there the shift had already kind of happened where people were really looking into doula care. And moving back to North Carolina, I had previously been in Charlotte when I lived down here, and in Charlotte everyone's hiring doulas. Everyone knows about doulas. There's tons of doulas. In Boone, in the high country, it seems less common, and the thing that I've noticed is a lot of families just don't know that it's a service that exists, and they don't know the benefits of it. There's kind of this pride around like, well, I'm fine, I'm gonna tough it out. Like, all my friends had their babies and had the sleepless nights and it was fine. But I think that there's this kind of like struggling in silence that happens in these rural communities. So having providers kind of mention the different resources that exist, I think is really important. And the more that providers kind of support the work that doulas do, the more likely it is that insurance will eventually cover the service. When I was in Vermont, I worked with a family where the mom had bipolar and had gone catatonic before, and we were really concerned that that was going to happen postpartum. And she did go into postpartum psychosis, and her husband wasn't home. I was the person that was there. I'm the one who got her to the ER. But the reason I was there was because her doctor wrote a prescription for doula services, and her insurance was able to offer not a great reimbursement, but they covered part of the services. So we knew that she would have somebody there on the days that her husband was out of town, and somebody that kind of knew what warning signs to look out for. I think a lot of people who go into doula work are focused at first just on their doula certification. But after I got certified as a doula, I went and did a bunch of trainings on perinatal mood and anxiety disorders, how to screen for PMADs. The families I work with, I'm working with them in their home, and I'm spending long hours with them. I get a lot more time with them where I can build trust, and they open up about things that they probably aren't mentioning at their appointments prenatally. And if they're just having the 1 6-week visit postpartum, there's a lot going on in those 6 weeks. I'm with the family as soon as they get home from the hospital. So there's things that I'm catching that they might either just not feel comfortable opening up about in an appointment, they run out of time and don't mention it, or they're just scatterbrained and they get home and they're like, I forgot to ask this thing that I meant to ask about. So I'm kind of able to do the screening and see like, are there warning signs for postpartum depression? Is this something more severe than the baby blues? Do I need to make a referral? And I try to be as well connected in the community as possible so that I know who has the ability to take on a new patient, where to go for different issues, like if they're having a pelvic floor issue, who to recommend for PT, things like that. I'm going to stop for a minute and see if anybody has any questions just about kind of the general role of a doula. And then, yeah, I'm also a CLC and trying to finish my IBCLC, but got to get 1,000 clinical hours in, so I'm going to be in the mother-baby unit for a while. But I think that just having like a general understanding of breastfeeding support is really important, especially since the IBCLC that was staffed at this hospital is no longer here, and all we have is a PRN doing lactation support, which is great. She's incredible. But I think that it's kind of pushed some of the nurses and doctors into a position where, like, now you're probably going to be hearing a lot more questions from families about lactation. And then just, if not even like on the labor and delivery unit, but in the postpartum period, a lot of people don't know. I've noticed that a lot of people in the community don't know that there's outpatient lactation support, and they don't really know who to go to. So I imagine a lot of those questions would end up being asked to you all. I think obviously your education covers like the stages of lactation, and you're going to have an understanding of how breastfeeding works. But from what I've learned just being out in the community, I think that the biggest issue I'm seeing, and I connect it all back to mental health, because that's like the biggest struggle I see with families, moms and dads. And I think that the mental health stuff, it impacts the whole family long term. So it's a really important thing to focus on. But there's just like misunderstandings around what's normal. And then families are, moms are at home, they're holding a baby all day, they're scrolling through social media, they're seeing all these posts about how beautiful the postpartum period is. And yeah, it's beautiful, but it's also really messy and really stressful and really overwhelming. And they're going through this huge hormonal shift that's one of the biggest shifts they're going to go through in their lifetime. And just talking about like what's realistic, what does lactation and breastfeeding look like, what's that going to look like overnight, how can their partner support them. If I have a mom who's pumping and I'm not there one night, I'm going to see if that dad will get up and do the cleaning and sterilizing of the pump parts, and maybe help with the nighttime feed if they're pumping. If the mom is breastfeeding, if I'm there, and I try to have the dads do whatever I do on the nights that I'm not there, if they have a partner. But if I'm there, I have usually the baby starts to wake up, and I do a diaper change at the start of the feed because it's going to wake the baby up a little bit and get him a little more stimulated. But I know that after someone gives birth, going to the bathroom is hard for them. So if the baby starts to wake up before I even do a diaper change or anything with the baby, I go and wake up the mom and let them know, like, we're about to do a feed. She gets up, goes to use the bathroom. I get baby all situated, bring baby to her. She does the feed while she's nursing. Usually in the beginning, the moms will have some questions and we'll kind of go over some lactation support. But my goal is that the feeding happens and then I take the baby and that mom can go right back to sleep. So I don't want to have like big conversations at night when that person's half asleep and wants to go right back to bed. My goal is like, don't get anybody too awake. Like, keep the lights low, try to make it so they can go right back to sleep. So while she's nursing, I would like go and fill her water cup and make sure she has like a snack or whatever she needs. And then I take the baby and she's able to go back to bed. So on the nights that I'm not there, I want the dad or the partner to step in and do that if they can. I understand that some people, like, it doesn't work for their family, but if there's the ability to do that, I think it's really important. And I find that a lot of dads want to be involved and have some kind of way of helping, and they just don't know how. So being able to kind of direct them on practical ways to help out, I think is really great. In the beginning, when we're counting wet and soiled diapers and kind of trying to track that to make sure that baby's output is good, giving the dad the role of tracking that. And it sounds like such a simple thing, I think, to a lot of people, to be like, oh, your job is to count diapers. But the dads want to be involved, the partners want to be involved, and a lot of times they just don't know how. And there's that cultural piece to it where, like, in Vermont, it was very different than families here. I think here there's more of that kind of like gender roles. The dad isn't as involved, like with the little baby, and doesn't really know what to do. And I'm finding that a lot of dads want to be more involved, and it just wasn't the culture in their family, so they just don't know how, because they didn't grow up like caring for the babies in the family. That was the role of the women. So I think with lactation support and just anything with families, just providing some practical tips on partner support. And then after someone delivers, I think skin to skin contact is huge. I think that's one of the really simple things where, like, if there's space to do it, if there isn't that urgency and we know that that mom and baby are good and we can put baby on mom's chest and do skin to skin, that's really going to help promote bonding and get oxytocin flowing and help with milk supply. So just thinking about like things that you can do when supporting families, I think that there's not like, when Molly was asking me to come up with like a list of some tips, I was like, there's not like this big thing that needs to change. It's all these like little things that if we put them in the way that we practice and the way that we talk to families, they have this domino effect and they're really going to help the family. But just starting with skin to skin and getting that bonding down. And I don't know if you all have learned about this yet, but after a baby's born, the nipple smells like amniotic fluid. It has the same scent. So if you place a baby on someone's abdomen, the baby will do something called the breast crawl and like army crawl, like a newborn baby. It is, the videos of it are insane. I've only seen it once in person because most people, they just put the baby on the chest. But if you put the baby on the abdomen, the baby will crawl to the breast. Like there are just these fascinating things that, like, as human beings, we're born with this this instinctual kind of behavior. That's where the baby wants to be, and that's where they're trying to get to. And not just for breastfeeding purposes, but also like there are all these studies that were done on C-sections where the OR was super cold. They were trying to get the baby to warm up after a C-section. They were wrapping the babies in blankets, and they found that even without a blanket, if they just placed the baby on the mom's chest, the baby warmed up to the temperature that they wanted the baby at. So there's so many benefits to skin, but I think that's like something that I hope you all are learning about, and I imagine you are, and that it's something that you recommend for families. But yeah, I think just the three like biggest things for me with lactation are encouraging skin to skin, being realistic about what you're telling families, and providing some kind of like practical tips and pieces of advice. Any questions?
When you are doing like postpartum and lactation support, what kind of options are there for like your services? I guess like if somebody needs like just some help like actually with the lactation part or latching or whatever, like troubleshooting, versus like what you said you can do with people's homes and stuff.
Yeah, so I think that the care that I offer is just very personalized to the family. So I have like my hourly rate. If a family's doing overnights, it could be that they book me for like an 8 or a 10-hour overnight shift. It could be 3 days a week. It could be 5. It could be 1. Okay. And we kind of go off of like, what hours do you want? How many days of the week do you want? And how many weeks? And I always tell them to book the minimum, and then we can always add on. For lactation, I could do like an hour Zoom call. I could do an hour like where I go to their home. I would say like an hour. Sometimes it's going to be longer. For lactation, I usually do like a flat rate because depending on like the baby, I might get there and their sleep might be thrown off that day, where we thought we scheduled the session for a feeding time, but the baby's sleeping really well. So let's focus more on the emotional support for a little bit and then wait for baby to wake up and go from there. So it kind of changes. I have a nonprofit, so I get grant funding. So if families really need support, it's free. I also have a baby wearing lending library with over 50 carriers. So I go and talk to families about how to safely wear their babies in like wraps or structured carriers. I've seen a lot of families where they buy a carrier and they have their baby facing outward immediately, which we know like a newborn's neck cannot handle that. And that puts them at risk of death. And that's not how I say it to families. I'm not like, your baby's gonna, but I just like provide them with the information on how to safely baby wear. And the benefits of that with bonding, and if their baby really likes contact naps and they're not going to sleep in the crib and they're not going to sleep in the bassinet, and that mom's getting super stressed out, for them to be able to wear their baby and still be up walking around, and have their hands free, and to bond with their baby and have that kind of connection. And then like going out in public, they might like baby wearing better than bringing a big stroller. I think, one of the recommendations for someone after they give birth is they're typically told, like, don't pick up more than 10 pounds, but then they're given their 7-pound baby in like I think the lightest car seat you can get is not the one most families get, but it's like 5 to 7 pounds. So if you have a 5-pound car seat and a 7-pound baby and you're told don't pick up 10 pounds, but then you're carrying that weight around during a time where you're not supposed to put a lot of stress on your body. Also, carrying a car seat is kind of a pain. Like, they're big, they're bulky. So teaching families how to baby wear so they can just have like a ring sling in their diaper bag. They go to the grocery store and their baby's in there. Also, I think it offers some peace of mind because there are a lot of people out in public who just like to touch people's babies. And when there's a baby in a stroller, there's always the sweet old lady who means well but comes over and is like, oh, I just want to touch your baby's face. And when we're in like flu season, COVID, RSV, like, don't touch people's babies. So I think for some people it's kind of like makes them feel safer having their baby out and knowing their baby's on them and that like nobody's touching them. There are these studies that were done in Kenya called the African Babies Don't Cry study. And what it found is that the babies in Kenya and these villages are worn and they don't cry because they have everything they need right there. They hear their mother's heartbeat. They have direct access to the breast because they can breastfeed while they're baby wearing. So the babies don't cry because they have no reason to. So I think that baby wearing is great too because the babies are calmer, and a calm baby is going to mean a calm parent. I think that so many times I see like a baby starts to get overwhelmed, then the mom's overwhelmed, and they're just kind of like feeding off of each other, and then everyone's escalating and it's too much. And then it's hard to calm a baby when you're stressed because they're picking up on that. So I think baby wearing's great. And yeah, I do birth support. I've attended a birth here. But I have found that the biggest barriers in the community are just like lack of knowledge on what a doula does. And then the financial barrier. So I try to find ways to get the services to be covered, whether it's through insurance or I had a partnership with Blue Cross Blue Shield this last year. We did a perinatal support group at the Blue Cross Center. Stick Boy catered it. So every Friday morning we'd have breakfast. I'd have a different topic or guest speaker, and it was to prepare people for pregnancy, like what was coming up in their pregnancy, birth, and postpartum. I think that the biggest thing that I do for families is the educational support. My whole brain is just full of all of this information on maternal health and reproductive health and how to take care of your baby and all of the different interventions that might come up in labor and how to manage the pain a little more naturally. Like it's like an encyclopedia. Like that is my jam. I know so much about it, and I feel like it's probably the same for you all with like all the medical knowledge you have. And I think sometimes it's easy to forget that like other people you're talking to don't have all that information in their head. And a lot of parents don't even know where to start with what to research and what to learn about. So they're really just going off what their provider tells them. And I've had so many families that I've worked with where like there's just things that come up postpartum where they're like, nobody talked about this. I didn't know I'd be sweating all night. I didn't know I'd be losing my hair at 4 months postpartum. Like, I didn't know these things would be going on. Is this normal? What do I do about it? And then they post in a Facebook group and everyone gives them like really weird tips and advice. And it just kind of continues that spiral of anxiety. So I think for me, just like being able to meet with families and talk to them and give them evidence-based information to help them prepare and know what to expect and know what's normal to kind of reduce the anxiety a little bit. and then for a lot of the families that attended the group, it was just a place where they could talk to other people who were going through the same thing. Whether it was they went through with another pregnancy and they were on their second pregnancy and could offer advice based on that, or just going through the same thing at the same time. But then I was there to kind of be like, okay, here's some evidence-based information on that. So we're getting that like peer support piece, but also more professional advice. And I partnered with UNC Chapel Hill to use their fourth trimester resources. They have so many resources on their website. So all the families that attended got like a kit with a little booklet on like what to know about your pregnancy, what to know about postpartum, what warning signs to watch out for, safe sleep. We had someone from UNC guest speak over Zoom, and they talked just about safe sleep. And they were really great because the reality is that we're seeing a lot of people co-sleep, and we can't just say like, oh, you shouldn't co-sleep, because they're still going to do it. So being able to provide information on like, okay, I know you're going to do this. How do we do this safely? And what do you need to know to make sure that you're doing this in the safest way possible? And making sure that families understand the risks, because there are, with anything, there are so many families I've worked with where they're like, well, this is the way my mom did things, like putting bumpers on the crib. Now we know you're not supposed to put the bumpers on the crib because of the risk of suffocation. But if they're not reading up on that, if they're just trusting someone in their family who had a baby 20 plus years ago, that information's outdated. So just going over the risks and then letting them make an informed choice. Obviously, there's some things where they might make an informed choice that is not okay and is really risky, and we have to uphold being mandatory reporters. But when it's things like, are you going to co-sleep or have your baby in a bassinet in the room or have your baby in their own room, just kind of like explaining the benefits of each thing and the risk of each thing. Like the research shows that the baby should be in the same room as the parents for, we say 6 months in the US, but really the World Health Organization says at least a year. So just kind of going over like, here's the risks and benefits of this thing, but is this practical for the family, and how do we kind of meet them where they're at? Any other questions? I feel like I'm throwing a lot of information at all of you, and I don't know if this is making doulas more confusing or okay.
I guess I have one question. You kind of touched on how you get grant funding, and like in Watauga County, we have a higher mortality rate than the national average, really vulnerable population. I was wondering if like the doula community, if there's like more initiatives to try to provide this service to like really vulnerable patients.
That's my goal. I haven't seen much being done by other doulas, just because if they don't have the nonprofit status, they don't qualify for funding. But I am connected with the Western North Carolina Community Foundation, and they said that there are some grants coming out next year that are really going to be focused on that. So that's on my radar to apply for in the spring. And then my services can be free for anyone who needs them. I think that one of the issues doulas kind of run into is a lot of hospitals won't recommend a doula. Like they'll say you should hire a doula, but they don't have one that they specifically recommend. And I think that those connections are needed, because the patients you're seeing trust you. And if you're like, I've worked with this person, I've seen great outcomes, they're more likely to reach out and hire that person. And for me, it's not like, oh, I want these connections because I want to, I mean, obviously you need to like make money and have a career, but like, it's not, oh, I want all these connections so I get all the referrals. I can't take on every family. There are going to be times where I'm fully booked and I'm going to recommend a different doula. But if there's some kind of doula organization that has the funds to cover the services for free for a family who is who are in that vulnerable population, I think the services should be recommended by their provider. One of the things I'm trying to work on is I'm really determined to learn Spanish this next year and make sure that I have had to take a Spanish medical terminology course, because my first day doing clinicals for lactation, the first person that I saw walking down the hallway had the iPad translator and is trying to go back and forth with the like nurse and this person on the video, and you can just see like that they're not connecting the same way as someone speaking to them and having like a very personable conversation. And I'm over in Ashe County, and we have so many people who just aren't receiving the care that they should be because we don't have Spanish speaking providers, and those families don't want to go to the providers, so they're missing appointments. They're less likely to show up for that postpartum visit. Yeah.
Okay. Well, I mean, if you guys have cards or like flyers, we could certainly put them like in the
Yeah, that would be great. Yeah, Molly has my flyers.
Okay.
I have a weird random question.
Okay.
I don't know if Doulas help with this. I had a patient yesterday who asked me about colostrum harvesting. Are those services that you help provide or can guide patients on it?
Yeah.
Or just like, when do I start and how do I do it? I have to look it up.
Yeah, that's something so doulas offered like general lactation support. So I would look for either a doula who has their CLC or IBCLC, or just refer to an IBCLC. So I would connect them with the IBCLC in the mother baby unit.
And they should be able to help with that. Okay.
Yeah.
She started like she's 30, 60 something now.
Yeah, there's some people who have mixed opinions on it because there's a lot of providers are concerned about it inducing labor, which there are people who tandem nurse and they're nursing a toddler while they're pregnant, and that doesn't induce labor. So it's just kind of like providing some evidence-based information on it. But the mother baby unit, the lactation room up there, they have like special colostrum collectors that collect like the tiniest little bits of colostrum, because sometimes it'll get stuck in the tubing of the pump. So they have like special resources for that. So that would be where I would direct them.
Thank you.
Yeah. Anything else?
Thank you.
Yeah. Yeah. Thank you all.